So in case you didn't see all the answers to this question, decongestants and antihistamines are used, especially the second generation, not the first generation antihistamines, and did not check the antibiotic box because viral coryza viruses aren't treated with antibiotics. If you're following along in your book, we're on 542. It talks about epistaxis. That's the medical term for nosebleed. Epistaxis is more common in older people, and especially those taking blood thinners or anticoagulants. So that's a sample question about epistaxis. Also, whenever anyone has a nosebleed, and I used to get nosebleeds a lot as a child, and what you want to do is have them tilt their head slightly forward and then apply direct pressure, using a tissue for 10 to 15 minutes. This was treated very poorly for me when I went to elementary school, and I didn't have a school nurse, but the teacher or the secretary would always have me tilt my head backwards or even lie down, and that's no good because when someone has a nosebleed, that's just going to make all of the blood run down their throat and into their stomach, and so then not only did I have a nosebleed, but I was throwing up. And then, throwing up blood because they'd made the blood run backwards. And so my mother, I can remember, poor mom, she'd get so mad when they would do that. And they'd call her and say, Charlotte's throwing up. Well, did she have a nosebleed? Yeah. Did you make her tilt her head back? Yeah. Well, it's no wonder she's throwing up. So just remember that when someone has a nosebleed, have them tilt their head forward until you stop the bleeding. There's some other things that we can do if your book talks about a nasal balloon catheter, nasal packing, and you can read about those. I'm not going to add those to the lecture right now, but that would be in cases where after 10 to 15 minutes it doesn't stop. I think I have one more sample question. Yeah. A client arrives in the emergency department with a bloody nose, which is the initial nursing action. Place the client in a supine position. Well, I just told you not to do that or you're going to have a throwing up client, right? Apply an ice collar around the client's neck. Well, ice collar might be good, but it doesn't need to go around their neck, right? The problem is the nose, and so if we were going to use ice at all, it would need to be applied to the nose. Next, assist the client to a sitting position with the head tilted slightly forward. Yeah, that's what I said. And then this last one, instruct the client to swallow the blood. No, then you'll have someone throwing up again. So here we go. Follow Charlotte's mom's advice. Tilt the head slightly forward so that they don't throw up. If someone comes into the emergency department with facial trauma and a nasal fracture, here's where applying pressure for 10 to 15 minutes probably isn't going to cut it, and also it might be very, very painful, so we can't do that. So an alternate thing, if you can't apply pressure because we have a fracture going on, would be to use the ice pack. And again, we want the ice pack to the nose, not to the neck. Next, we're going to talk about sore throats. So pharyngitis and tonsillitis. Hopefully you remember that the pharynx is just our medical term for the throat. And so if someone has pharyngitis, they have inflammation of the mucous membranes of the throat or the pharynx. This commonly occurs along with acute rhinitis or sinusitis, and is more commonly in the late fall or spring. It's also caused by the virus, the same virus that causes cold symptoms. Signs and symptoms, if it's viral, would be what's called rhinorrhea. Rhinorrhea means inflammation of the nose, headache, hoarseness. It's going to have a gradual onset, low-grade fever. Usually if we do a CBC, it's going to come back normal, so it's not going to have an elevated white count. And if we do a throat culture, like for strep, it's going to come back negative, and complications are pretty rare, just good old inflammation. So sorry, I had the wrong slide on. Here's my slide for viral pharyngitis, low-grade fever, complications are rare, negative throat culture because it's viral. One exception to the rule would be viral pharyngitis that's related to mononucleosis, and that's a little bit more serious of an infection. Infectious mononucleosis can affect the whole body, and so it can be systemic. Central nervous system, it can cause fatigue, loss of appetite, headache, sensitivity to light, and then we already talked about how it can affect the throat, red, swollen tonsils. Respiratory can cause a cough and enlarged lymph nodes and a large spleen as the body tries to fight it off. And it can take a long time for someone to get over viral mononucleosis. Bacterial pharyngitis, on the other hand, so we were talking about viral, now we're to bacterial, is a little bit more concerning because it's often caused by group A strep. And we've already talked about how group A strep can go on to cause problems with the kidneys or the heart. And so it needs to be treated with antibiotics. Scarlet fever is what it's called when it affects the heart valves, and glomerulonephritis or rheumatic fever when it affects the kidneys. So bacterial, a lot of times you're going to see these white pustules. Fever is going to be higher. It has an abrupt onset rather than a gradual. If we do a CBC, we're going to see elevated white count. It can also cause a lot of joint and muscle pain, and throat culture will come back positive. I've already warned you in class that if you tell me your throat hurts, I'm going to take a look and see what I see, and that if I see something that looks like this, bacterial, out you go. Go see the doctor, and just like this says, go to the health center, get some antibiotics, come back later. If I look in there and instead I see just a really red and inflamed throat, monitor at home, gargle with salt water. So that's kind of the rule of thumb with those. If you see white pus, that is no good. Now, I don't want to imply that a viral sore throat hurts any less than the other. Here's a close-up of group A strep, so this is strep throat with the pustules. And this is viral, but see how swollen those tonsils are? This person is experiencing a great deal of pain, so I don't want to minimize the effects of the tonsillitis viral, but it just can't be treated with antibiotics. So if it's bacterial, we can use antibiotics. Both respond to warm, soft foods, analgesics such as Tylenol, humidity, and lots of water. Some people find chloroseptic lozenges or spray can kind of numb the throat a little bit. Throat gargles or irrigations, a lot of times salt water is recommended. And if someone has fever, we might have them on bed rest for a short time. I kind of covered pharyngitis and tonsillitis at the same time, although this one's just confined to the throat and this one's related to the tonsils. Most cases of both pharyngitis and tonsillitis run their course in 7 to 10 days. However, a person may have repeated infections that do or don't respond to treatment very well, or develop what's called chronic infection. And in that case, we might need to move on to surgical treatment known as tonsillectomy. Very, very common surgical procedure, probably one of the most common ones done. A tonsillectomy and adenoidectomy is usually recommended with repeated infections with group A beta strep, or if someone has a history of abscesses. Frequent tonsillitis can result in the development of abscesses. It is not a routine childhood surgery as it was once considered. However, it's still pretty prevalent. If you've ever wondered how it's done, here's a quick picture of someone having their tonsils removed. And here's what they look like when they come out. And here's our post-op pictures. And I want you to note that it's very common, this white patchy, this isn't pus. This is the scabbing. So this is what we would expect to see. This is day 1, just a few hours after surgery, day 4, day 5, day 10, day 16. And so gradually this these white patches will disappear. But this is quite different than the strep throat that we were looking at earlier. When it comes to a tonsillectomy, nursing is mainly involved in the post-op, and the two big problems associated with a tonsillectomy are hemorrhage, so bleeding, and respiratory distress caused by swelling and closing off the airway. So some interventions that we're going to do. First of all, the patient's not supposed to cough or clear the throat. That can dislodge clots and start the bleeding again. For the same reason, they're not to use straws. That creates that pressure that can, again, dislodge the clot. One thing that we don't think of is, I have in red for that reason, watch for frequent swallowing. This can indicate that there's blood running down the back of the throat. The patient may not know it, but when we see them swallowing frequently or more frequently than we think they should, then you might be seeing some hemorrhage that's hiding because they're swallowing the blood. Now, eventually they'll probably throw it up, but we'd like to catch it before then. Initially, in the early post-op period, we'll position them on their side. And then, of course, after they wake up, we can sit them up and start offering fluids when they have a gag reflex. We're going to use pain medications. Tonsillectomy is a fairly painful procedure. Ice collars to reduce the swelling. Cold drinks are great, but we want to avoid anything acidic, so no orange juice, or I would even avoid something like Coke. Might be a little too acidic and cause some burning. Cold or frozen liquids are great. We want to avoid colors though, red, purple, and chocolate, because if you look in the sink, someone has thrown up, it appears, and so we don't know, is this a bunch of blood or is it the cherry pie that they just ate? So that's why we want to avoid things that are red, purple, or chocolate, so that we can tell the difference between bleeding, or if they throw up, is it blood or the food that they ate. Also, it's not a specific contraindication, but be careful with milk products. A lot of people find that their milk products thicken their mucus. It's not a contraindication, and just like you've always heard, you get ice cream after you have a tonsillectomy, and that's probably okay. Just make sure that your patient isn't developing too much thickened mucus from dairy products. So here's a question related to foods after a tonsillectomy. Which should be avoided? Frozen liquids, ice cream, applesauce, citrus juices. I know I just said be careful of the dairy products, but they can still have them. Just some people, like I said, are a little bit sensitive, but definitely avoid the citrus juices. Those can cause burning. Two major problems that develop in the post-op phase of tonsillectomy are respiratory distress. That's the first one, and the other one, hopefully you remember, was hemorrhage, bleeding. And so again, that's why we avoid those different colors of food. Laryngitis, or inflammation of the larynx, may occur alone, or it may accompany other respiratory infections. It can also be caused by voice strain, smoking, alcohol ingestion, or the inhalation of irritating fumes. All of those can cause or make laryngitis worse. Signs and symptoms: most people know laryngitis causes hoarseness, so you lose your voice. Sometimes it's painful, sometimes not. If you want to know the term aphonia is the absence of sound production, so you might see that in the future. Aphonia just means not being able to talk. Changes in the voice may be permanent after long periods of chronic inflammation. And the treatment, voice rest, and sometimes that's one of the hardest things to do, but voice rest reduces the irritation of the larynx, and that's what's required for laryngitis to heal. If someone refuses to do that, then they can develop chronic laryngitis, and that can have some pretty bad effects in the long term. Anytime you are dealing with chronic inflammation that never lets up, you can increase your risk of actually developing cancers, which is no good. Another upper airway disorder that I wanted to briefly cover, it's not in your book, but epiglottitis. Of course, that's inflammation of the glottis, the epiglottis, the little part that separates the trachea from the esophagus. This can be very serious, and in this case, we don't want to use a tongue blade because that can make it worse. We can send somebody into spasms, and this is pretty scary. It can feel like they're choking to death. We might hear that respiratory stridor. That's air trying to make it through a very, very constricted airway. No oral fluids. We'll give IV fluids until they get over it. Humidify the air, and have a trach tray or endotracheal tube available, because in this case it can get pretty scary. We might have to intubate somebody until they get over this. We'll stop here and then continue with acute bronchitis.